Every single second of every day, your body is performing this incredible, nonstop balancing act. It's managing your blood pressure. And really, it's a constant tug of war between two extremes, getting too high and dropping too low. Today, we're going to unravel this whole complex story and figure out what it all means for our health. So that brings us to the big question. Which one is the real villain here? High pressure or low pressure? You might think the answer is obvious, but it's actually way more complicated than that. Both hypertension and hypotension give us this amazing window into how our bodies work, and understanding both is absolutely key. So here's how we're going to break it all down. First, we'll start with the basics of blood pressure's balancing act. Then we'll dive right into our two extremes, the story of what happens when pressure gets too high, and then the story of when it drops too low. After that, we'll get a peek behind the curtain at the body's incredible control system, and finally, we'll wrap up with the most important takeaways you need to remember. All right, let's get right into it. Part 1, blood pressure's balancing act. What are those numbers they give you at the doctor's office really telling you? Honestly, the best way to wrap your head around it is to think about the plumbing in your house. It's a perfect analogy. Your heart, that's the pump. Your arteries, those are the pipes. So blood pressure is just the force of the blood pushing against the walls of those pipes as it gets pumped all around your body. And just like with plumbing, if you have too much force or not enough, the whole system can get into some serious trouble. So let's explore that first problem. What happens when the pressure in those pipes is just constantly, dangerously high? Well, that brings us to our first extreme, the story of hypertension. Now, for the vast majority of people, we're talking like 90% of cases, there isn't one single thing you can point to as the cause. Doctors call this primary hypertension, and it's really a mix of a whole bunch of factors all working together. It could be your genetics, how sensitive your body is to salt, your weight, whether you're living a more sedentary lifestyle, alcohol, and yeah, just getting older plays a big part too. All these things can conspire to crank up the pressure in your system. And this is why we have to pay attention to it. See, hypertension isn't just a number on a chart. It's this silent force that slowly but surely does damage to really important parts of your body. It's one of the biggest risk factors for atherosclerosis. That's the hardening of your arteries, which can then lead to heart attacks and strokes. It also puts a massive strain on your kidneys and can even mess with the tiny, delicate blood vessels in your eyes. It's the very definition of a slow burn. But sometimes, it's not a slow burn at all. Sometimes the situation becomes critical, and it becomes critical fast. Take a look at this number right here, 180/120. When you see this isn't just high. This is a code red situation for your body. A number like that means you're in what's called a hypertensive emergency. We're not talking about long-term risk anymore. We are talking about immediate, serious damage happening to the brain, the kidneys, and the heart right now. It is a true medical crisis that needs immediate emergency attention. Okay, now let's completely flip the script and look at the other side of the coin. What happens when the pressure in the system suddenly bottoms out? Welcome to the world of hypotension. I bet you've felt this before, that sudden head rush you get when you stand up too fast from the couch or bed. That's often a classic case of what we call orthostatic hypotension. The technical definition is a drop of at least 20 points in that top number or 10 points in the bottom number, all within 3 minutes of you standing up. So what's actually happening here? It's a pretty simple chain of events. 1, you stand up. 2, gravity does its thing and pulls a bunch of blood down into your legs. Now, normally, your autonomic nervous system instantly kicks in to squeeze those vessels and push blood back up. But if that system is a little slow to react, number 3, then you get less blood going back to the heart, which means less blood gets pumped up to your brain. And the result? Dizziness, maybe some blurry vision, and sometimes you might even faint. Now, it's really important to separate that from another common reason people faint, which is called vasovagal syncope. They might look similar on the outside, but they're happening for totally different reasons. Orthostatic hypotension is a mechanical issue. It's triggered by the simple act of standing up, and it's a failure of your body's reflexes to keep up. Vasovagal syncope, on the other hand, is triggered by stuff like intense emotional stress, sharp pain, or even just the sight of blood. It's not a mechanical failure, it's a massive overreaction from a nerve that basically slams the brakes on your heart rate and causes your blood pressure to just plummet. All of this kind of begs the question, right? How in the world does the body normally manage this incredible tightrope walk between too high and too low? Well, let's take a quick look at the brilliant machinery working behind the scenes. It's actually amazing. Your body has this brilliant two-part system. For those moment-to-moment quick adjustments, like when you stand up, it uses short-term controls, which are mostly run by your nervous system. But for long-term, big-picture regulation, it relies on the kidneys to manage the balance of fluid and salt in your body. And a huge player in that long-term game is this hormonal cascade called the RAAS. Now, I know it looks complicated, but it's a really logical process. It all starts when your kidneys sense that your blood pressure is a little too low. They release a substance called renin. This kicks off a chain reaction that ultimately creates something called angiotensin II, which is a super powerful hormone. It does two things. It constricts your blood vessels, and it tells your kidneys to hold on to more salt and water. And the final result of all that? Your blood pressure rises. It's an amazing feedback loop. Okay, we have explored both ends of the spectrum, from dangerously high to dizzyingly low. So now, let's bring it all home and lock in the most important points from our tale of two extremes. So here's the bottom line. High blood pressure or hypertension is fundamentally a problem of too much resistance in your pipes and too much fluid volume in the system. That head rush you get when you stand up, that's orthostatic hypotension, which is just a brief failure of your body's automatic reflexes. And that other kind of fainting, the one triggered by something like stress, that's vasovagal syncope, which feels dramatic, but it's generally a harmless overreaction of your nervous system. So, in the end, your blood pressure is so much more than just a static number on a machine. It's a dynamic, constantly changing story about what's going on inside your body. The real question is, are you listening to what it's trying to tell you?